Well, good afternoon, everyone, and thank you for joining us for the TMLT webinar today. Welcome to 2020 and Happy New Year to you all. We appreciate your time today. Today, our topic is going to be, it's time for your annual HIPAA checkup. You will notice on the left-hand side of your screen a downloadable pod. Please be sure to download the PowerPoint from today, as well as a couple of resource documents. There is one there labeled 2020 HIPAA checkup. That will really be the backbone, if you will, and the starting point for your HIPAA Healthy Compliance Program for 2020 and what we will be referring to later on in the program. There is also a Q&A box to the right of your screen. Please feel free to add any questions that you may have as we go through the presentation today. Again, we thank you for joining us. My name is Cassie Turner, and I am a Senior Risk Management Representative, and I also work in the Products Development and Consulting Department with HIPAA Compliance and Risk Assessments. And we will also be joined today by Kathy Bryant.
Hi, and I'm the manager of TMLT Product Development and Consulting Services.
So before we begin, we just would like for you to take a peek at this disclaimer and just be mindful that this should not be used or referred to as a primary legal source, nor as a standard of care. It's just simply a resource for your benefit and for your education purposes. So again, new year, new decade. Welcome to 2020. Our goals for today of this webinar is to hopefully help you identify issues early and to prevent complications further down the road. It's also to offer you a checkup and a quick look, a high-level look at your compliance, and to get started off in 2020 with your annual HIPAA checkup. So as we go through this, we want to be mindful that a healthy HIPAA checkup should examine all of the privacy rules, the security rules, as well as the HIPAA breach notification rules. Those three sets of rules, if you need help finding out what those are, please just send us an email, but we're going to be looking at those today. And today, specifically, we will cover an internal review of your HIPAA-related processes, policies, and procedures. We will also look at common issues that we normally see that are identified in risk assessments. And then we will also look at information update, news or updates that will impact your 2020 compliance.
Now, sometimes when we talk about HIPAA, I kind of feel like a broken record. Seems like we always talk about your processes, your policies, and your procedures. This part of the checkup is about how you do your work every day while protecting your patient's privacy or your patient's data. We change processes all the time. Like this morning, you might have gone through your morning checklist doing a certain thing. But if someone calls in sick tomorrow, your morning start process in your office may be entirely different because you might not have everyone there that you had today. We have provided, as Cassie told you, the 2020 HIPAA checkup document. It is a Word document so that you can use it to type your notes in as you go, so that you can do whatever you need to do to get yourself a good roadmap for getting started. Now, we're not going to read the checklist to you. We've provided it for you as a resource. We thought that we would use the time today to help you focus maybe on some things that you haven't thought about or heard about in a while. The other resource, besides the slides of today's webinar that we have for you, is the Third Rock Cybersecurity Rapid Repair Guide. This resource was originally provided at the September webinar when a couple of folks from Third Rock joined us for the webinar. This is a little bit deeper dive into some common cybersecurity issues and offers you some solutions to those as well. And that was, again, a great resource for either you or for someone in your practice to go through. Just a reminder, we don't want you to be confused that this is a security risk assessment, or this is a HIPAA risk assessment, or security risk analysis. They go by many different names. The security risk assessment that is required by the HIPAA security rule, MACRA, or MIPS is not going to be satisfied by going through the checklist. So again, the checklist is really an opportunity for you to focus on HIPAA at a very high level, and then to kind of create a roadmap of what you might need to review or do work on as the year progresses. As Cassie said, the HIPAA rules are always going to be the basis for everything that we try to talk about, because we don't want to give you opinions, we want to give you valuable information. And to do that, you have to have reliable sources. We all know we can't believe everything we read on the internet. And so we want you to have several resources, and we'll go through some of those later in the webinar. As you start looking at your processes, your policies and procedures, just keep in the back of your mind some of the hot topics that are out there in the HIPAA world or in our cybersecurity environment today, such as the individual's right to access their medical records. What about hacking? How can you protect your medical records, your electronic medical records? Social media, unencrypted mobile devices, and failing to notify Health and Human Services, or the OCR, of reportable breaches. Earlier actually last year, a hospital was fined a significant amount of money, $2.175 million. And in the settlement agreement announcement, the head of the OCR said, HIPAA compliance depends on accurate and timely self-reporting of breaches because patients and the public have a right to know when sensitive information is exposed. Roger Cervino went on to say that when healthcare providers blatantly fail to report breaches as required by law, they should expect vigorous enforcement by the OCR. And that just brings us to our reminder that when you have a breach of 500 or more individuals, you have 60 days to report that to the Secretary of Health and Human Services, or the OCR. But if you have a breach of fewer than 500, then you actually have 60 days after the end of the previous, or the calendar year in which the breach occurred. So this year, that happens to be February 29th. Now, most of us probably don't want to be working on February 29th doing breach reports. So it may be something that you want to work on sooner rather than later.
So what are some of the common issues for practices and risk assessment findings that we typically see? One of the more common issues that we see is data backup. This one can be a rather robust one to take on, but we wanted to give you a few things to consider as you're doing your checklist and looking at your data backup to ensure that you would have what you would need. So how do you back up your data? Do you have external hard drives? Are you managing it through the cloud? Is that done manually, or is it an automated process? Or do you have a vendor who is assisting you to back up your data? Another thing to consider is how often are you backing up your data? Are you doing it hourly, daily, monthly, annually, or so on? Or do you know, or is that something that you need to work with your IT or your MSP provider to find out what is the frequency of the data backups? Is your backup located off-site or is it on-site? And do you have a test restore that you've done at least annually? This we recommend that you demonstrate your backup process, that it's working, that your data is actually there and it can be restored. We have found at times that practices thought that their data was being backed up, and when they went to find it or try to restore it, the data was actually not there. So this is a big one, because without your data, that is really going to be a problem. So data issues and data backup is a common issue that you will want to look at as you're doing your healthy checkup here. Another thing that Kathy already mentioned that we do tend to speak on quite a bit is policies and procedures. The primary reason that we speak on this often is, one, it's required, but we also see that if the OCR is to make a visit, one of the things that they are going to ask you for is your policies and procedures. And so, do you have written policies and procedures that reflect your specific business and comply with HIPAA? Are these customized to your practice specifically, or are they just templates that maybe you acquired along the way, but they don't really reflect what you're doing in your practice? The OCR would expect now that those policies reflect exactly what you're doing in each of the categories that in each of the rules are addressed: the breach notification, security rules, and the privacy rules. Do you review these annually for changes? So as we've mentioned here, if there's ever a change to a federal or state law, you'll want to make sure that your policies and procedures are being updated. Or if you make a change to your practice or within your environment, if you have new IT, new EHR, if you move to a cloud, if you're getting new equipment, if you have a new privacy officer, a new security officer, those are things that you're going to want to keep in mind and make sure that you're updating your policies to reflect any of those types of changes. Are your policies available to your workforce members? Are they on a shared drive, or are they in a binder where staff can easily review those if need be? And then do you make a copy of your electronic or hard copy annually and maintain it for at least 6 years per the rules of keeping that documentation? So a few things that we've mentioned a bit about keeping hot topics in mind, things that will impact your 2020 HIPAA checkup. Going forward, one of them is the Windows 7 has finally come to an end, so Microsoft will stop providing free support for Windows 7, Windows Server 2008, and you can see the other equipment that they will not support and software that will no longer be available. So if you have any of these Windows products within your clinic, please make a note and address these, because they're not going to have any support or any fixes coming for vulnerabilities from Microsoft in the future. Here we just want to show you, and we'll delve into this a little bit more, the OCR complaints continue to increase each year, as you can see from 2015 on up to 2018. Kathy mentioned the director of the OCR being very diligent in enforcing, and their words are vigorously enforced. So we will see here that in 2019 there were numerous resolutions that occurred from the OCR, and I understand this slide is a bit busy, but we wanted to provide each of these links to you so that you could take a moment to look at them if you were interested. One of the things that we also wanted you to take away from this was that these resolution agreements now are varied. There are quite a few that have to do with right to access. There are quite a few that are here in Texas, so we're not immune here in the state of Texas to OCR enforcement. There was also one to social media response, and that happened out of Dallas. And the OCR director said that social media is not a place to discuss a patient's care. So these are some trends that we're seeing. Quite a few of them are related to the right to access, again, format, fees, and timely release to the patient. And we wanted you to have these so that you could take a look at them. They added up to about $15 million in fines and penalties over the course of 2019.
It's interesting to note that 15 million seems like a lot of money, but in fact, the 15 million is actually down quite a bit from the previous year in settlements. I mentioned earlier having reliable sources of information available to you on HIPAA, cyber risks, and cybersecurity. I've listed a few of them here. The Health and Human Services Office for Civil Rights website and their newsletters are available. Of course, we keep an eye on these, and when important information comes out, we do often try to help you by pushing them out through either the webinars, through social media, or even our website at our emails from TMLT. The Office of National Coordinator is another source of a lot of information. Their website is healthit.gov, and these are all hyperlinked, by the way. Looks like some of the print is a little light on the slide, but when you're actually on the PDF copy, you'll be able to hyperlink from that as well. But the Office for National Coordinator basically talks about two different categories of health information. One is the public, and the other is for professionals or the medical side of the world. It's interesting to watch some of the things that they're talking about on the public side. I think they closely reflect what the OCR is actually looking at when they're doing investigations. Of course, TMLT has great resources, our website, our resource hub, and we also have a quarterly newsletter, Cyber at TMLT, that you can subscribe to. The Texas Medical Association is another great resource. Their website and their Knowledge Center have tons of valuable information. And I always want to point out professional associations, whether it's Texas MGMA or whether it is something more like a professional society geared towards a medical specialty. All of these have valuable resources. You may remember that last year the Texas legislature was in session, and one of the things that the legislature did was they amended the Texas Identity Theft Enforcement and Protection Act. Beginning January 1st of this year, there is a new Texas reporting requirement. So if you have a single breach that affects 250 or more Texas residents, there is a required online reporting to the Texas Attorney General. We always encourage you to reach out to your cyber insurance carrier. If you are not, if you're TMLT, of course you can reach out to us, but whoever covers your cyber insurance, if you do have a privacy or a security incident, because we want them to help get you the assistance you need to make sure you do all the correct reporting, whether it's to the patient, the Office of Civil Rights, or now to the Texas Attorney General if that is required. Other states have other reporting requirements, and even if you may be seeing patients who are residents of other states, And of course, you would have to meet those as well. This is just a quick little snippet of the beginning of that data security breach report. It's a fairly straightforward form, but again, we would encourage you not to take that on by yourself. You may have seen an announcement actually on January 14th from the federal government. It came out in a variety of different publications and alerts, but it was a cyber notice that was an emergency directive to mitigate a Windows vulnerability. What happened was a vulnerability was identified in the Microsoft Windows operating system, which, if not addressed, could pose a significant threat to your environment. On the 14th of January, Microsoft released a software patch to mitigate these vulnerabilities. However, it's very important that you make sure that you actually have that update in place. We pushed this out through our social media accounts. If you have questions, because there are some technical parts of it, if you look at the actual notice itself, you can certainly reach out to us at consulting@tmlt.org. However, in the meantime, if you don't know if your network is protected, talk to your IT consultant. You can determine if your practice uses a remote desktop connection. They can help you determine if all your devices in the practice are operating behind a firewall. They can help you determine if all devices are automatically set to run those Microsoft patches. Typically, they are issued on a monthly basis, but sometimes in emergent situations, they come out more frequently. And you certainly want to confirm that the January 2020 Microsoft update has been installed on all your devices that are operating with a Windows operating system. The sad reality is there are significant impacts of HIPAA noncompliance. First, if you do have to report a breach to the Office of Civil Rights, or if they are investigating a complaint from a patient or someone about your practice, it is quite mind-boggling. It's like navigating a maze, because there are going to be data requests and correspondence that always seem to come at the most inopportune time. It may mean that you have to take time away from patient care. If you need to schedule a phone call with the forensics company, with your attorney, perhaps even with the OCR, it may mean that you need to cancel patients for the afternoon or part of the day in order to facilitate that call. There are often financial impacts to your practice. The additional expense and loss of revenue. It may be that you can't see patients because of the actual incident. Or again, it may be that you're having to pay overtime to help get things corrected in order to answer OCR investigations. There's always the chance or the risk of reputational harm, meaning that patients choose not to either come back to you or choose to choose a different provider in order to find someone that they believe is going to better safeguard their data. And of course, as Cassie pointed out, there are fines and penalties that are out there. And that is not simply just something that we're seeing with the whole advent of the larger practices. We're seeing that in some very small practices as well. We wanted to leave some time for questions today, but we do want to thank you for attending today's webinar. The slides and additional reference materials are available for you to download. Thank you for all of you who joined. That we do have, you will be receiving a link to the recorded webinar, and we'll certainly continue to take questions for as long as people have questions that they would like to ask. We'll get to the questions in just a moment. However, I would remind you that next month we are going to have part 1 of a webinar on cyber insurance, understanding your coverage. Our colleague John Southry will be joining Cassie and I in order to provide you some of his expertise on cyber insurance. We have a question. Will doing this checklist or other checks, provide documentation of them, help to reduce the amount, the almost 100% increase in cyber liability insurance? I'm assuming that this question is talking about an increase in cost that you have seen reflected recently on a cyber insurance renewal. I don't know what the cause of the increase is. Obviously, we know there have been many healthcare incidents, and that may be part of the reason. You would need to speak specifically to your insurance carrier to find out if there are ways that you can prove mitigation to help reduce that increase. If it's specifically about a TMLT product, if you'd like to reach out to us at consulting@tmlt.org or your underwriter, we can certainly help you look into that. I have another question about, do you have any specific guidelines for responding to online reviews online? Gosh, social media and online reviews is one of the most difficult things I think that practices tend to face in this day and age. TMLT does have some good resources on our resource hub about responding to social media, and I believe we actually have a podcast which also is available through our resource hub, specifically on responding to social media. That is a topic that we hope to cover in a webinar later this year as well. What is the best way to educate staff on HIPAA in an office setting of less than 50 employees? If you, there are lots of different ways, from you providing basic education and training on HIPAA, customized for your specific needs. That's something that our consulting staff can do here at TMLT. We also have some partners that offer online training at a very affordable rate. Again, if it's something you're interested in, feel free to shoot an email directly to consulting@tmlt.org, and we can provide you more information with that. Hopefully we've answered the questions on the social media and public comments. I apologize if some people were unable to log into the meeting. We've had a really high response to today's meeting, so if there is something that
Keeping medical records
we can
changed recently from 7
if
years
you
to
will be
6
getting the
years.
recorded webinar, you
Under the
can feel
Texas
free to
Medical
share
Board
that with
rules,
your
medical
staff
records,
or any of
unless
your
I have
colleagues.
missed something, Kathy, it's still required that you maintain those records for 7
Cassie, do you
years.
want to talk about
What you
medical
may be
records?
confusing with the 6 years is that is a requirement, the 6 years from the privacy and security rules that you maintain your HIPAA documentation for the 6 years. So I'm wondering if that's what created the confusion regarding the records of 6 and 7 years.
I am not aware of any change in the medical board rules from 7 to 6 years, and of course that is specifically for adults and doesn't relate to children or minors. In some cases, some contracts, specifically like Medicare, managed care agreements require you to keep your records for 10 years. So if you're considering getting rid of records, that's something you definitely want to think about. TMLT Risk Management has resources on that as well. Do you have an example of how small practices without a test environment for EHR do a test of restoring data from backups? I'm assuming that you are not a web-based EHR, because obviously if it was a web-based EHR, you could ask your vendor for their documentation that they have done a test restore from backup. If you are talking about having your local server, whatever method you're using for your backup can be restored. Your outside IT consultant will probably need to be involved. I actually do know of a fairly small practice that decided to try to do a test restore from backup using their IT people. Their IT people expected that it would take about 4 hours to restore from backup. They took the system down at 8 o'clock on Saturday morning, and they were not able to get it fully restored until almost time to open on Monday morning. So if you can do it in some platform that is not your operating platform, it would be very much encouraged. IT providers sometimes have a spare server that they can do the test restore to that server. There are all sorts of different options. But again, that's a very technical thing, and that would be something you'd want to coordinate very closely with your IT people. Another question about telemedicine and HIPAA. What are the security requirements for a telemedicine platform? As with anything else, when you're talking about telemedicine and you're talking about HIPAA, so you're talking about needing to have a business associate agreement with the vendor that's providing the platform. They need to provide you with adequate assurances that they are meeting HIPAA on their end. You also need to make sure that you know if someone is selling you a platform, that there is encryption on the data while it's in transit. So whatever platform it is, it has to be traveling through an encrypted database. You can't just be doing like FaceTime on your iPhone with FaceTime on a patient. that would not necessarily qualify as an encrypted platform. There are a lot of resources out there on telemedicine, and if you have some specific questions about going to telemedicine or looking for a platform, again, shoot me an email at consulting@tmlt.org, and we'd be more than happy to try to help get you connected with some resources. There is one final poll that we've just opened in the lower right-hand corner. Just want some feedback on, was today's webinar helpful? Or if you have comments that don't fall into the multiple choice, again, we're more than willing to get an email from
again,
you
if you would like to give us your
consulting@tmlt.org.
feedback down in that bottom right pod, we would greatly appreciate that. Or any comments. We did take down notes from those of you who gave us topics for 2020
Cassie,
that you may be
you have any
interested
final
in.
thoughts?
If a topic
Since I
comes
don't
to
see any
mind
other
later
questions coming in.
on, please feel free to also email that to us at the consulting@tmlt.org email. We thank you for your time today and for joining us for this kickoff to 2020.
It looks like there was a repeat question about the educating staff on HIPAA and HIPAA training. Again, probably the best way is to connect with you personally, so if you would just shoot us an email at consulting@tmlt.org, and we'll be more than happy to have you or provide you some resources on that as well. We hope you all join us for next month's